cuff. Did Kathy talk about the cuff on the 82?
Yeah,
Yeah.
pressure is
You
going
can-
yeah.
Yeah.
The different
High
pressure.
low.
No, she didn't talk about the
Yeah,
pressure.
she showed us the, well,
She didn't
talked
talk about the pressure.
expanding it and
She
then,
inflate it for you.
yeah, and then
Yeah,
how
she
you,
did.
after you like inflate it, you kind of
Alright.
pull back and make sure
How
you
you
get it
can
all
deflate.
before you.
The pressure inside this little cuff is extremely important. Let me show you.
Do you have an EOA in here?
If I go ahead and put some pressure in here, like this, does it really
That's a
matter
good
how
way to
much
show.
pressure
Yeah,
is
if
Oh.
in
you
here?
put too much pressure.
You can know
it
the
can
Low
be-
issues
volume,
of
high
one.
pressure, or high
Correct.
pressure, low. You compare the
If you
two
put too
balloons.
much pressure in here, that can cause damage to your trachea. Tracheal necrosis, there's like 3-4 different things. Kathy will teach you all that. But what's the normal pressure in here?
Not to exceed 20 millimeters of mercury or 25 centimeters of water.
That's extremely important. I walked in the patient room and I checked the pressure in here with the cuff pressure manometer. I think we have it here
I prefer
somewhere.
we can get the manometers.
We put it on. Yeah.
That's the actual checkoff next time with trachs. Y'all are gonna have to use
Yeah,
this
The
for
correct
real.
answer was until they stopped, you heard the lead stop.
I swear, I put it on and I found 100. See this?
Holy shit. That guy's gonna have tracheal problems.
What did they do? They just put too much air in the cup. Obviously, this patient had a lot of leakage. So they keep putting air in the cup.
Maybe the tube's too small.
Exactly. The tube was too small, so they kept on putting some air in the cup. And 100, that's going to damage the trachea, right? So what should I do? Get rid of the air, push on here, or use a syringe, deflate.
So you can push on that and that'll take
Correct.
the air out of it.
You see it,
Okay,
right?
and adjusting it. Okay, cool.
Tell me when it's
It's
20.
at 30 right now, a little bit past 30. You're almost to
20.
20. Hit it one more time. Now you're
below
about
20.
right. No, you're going too low now. You're 10. What you doing? You got it.
Is it good?
Yeah. Well, now it's below 20. Yeah, below 20. It's not 20.
Yeah, below 20 is fine. But in that green area,
Right.
that's about 18 to 25, something like that. But the thing you need to remember for the NBRC exam, they'll trick you. They give you millimeters of mercury and centimeters of water. You need to know the difference. If they tell you 20 millimeters of mercury, is that correct?
Yeah. Yes.
It says, yeah, well, less than 25 millimeters of mercury, right? How about if it's the of the water?
20.
That would be
25
20.
centimeters of water and 20 millimeters. of
Right,
mercury.
20 millimeters of mercury, 25 cms of water. Learn that.
And
It's
the
all the
manometer
test.
says right on there, whether it's millimeters of mercury or if you're reading it, centimeters H2O. Depending on which one the hospital buys.
Is that part of your ventilator checks every day
Yes,
too?
yes, that's part of the
So I
venture.
don't remember us doing it when we did it.
Yeah, that's a good idea. We check it once and we assume that's correct and we keep moving, but
Don't
we're
go
supposed
by
to
what
check.
we see at the hospital.
Yeah. We're supposed to
I know
check.
that can change from day to day. I mean, it could be a leak.
Yeah, well, yeah.
Do you do that? Do you go around?
You're
and-
supposed to do it like once a day, once a
Okay.
yeah.
I'm just
But I don't remember it being on your sheet.
Yes,
That-
yes.
It is on the
Yeah.
sheet?
Way at the bottom, right where you
It
write.
You have
should be
to walk
way at
around
the
with one
top.
of
It
them in
should be
your
the first
pocket.
thing
Yeah.
to do.
So if your volumes are the same and everything, you pretty
I
much
would
know
think.
that
And
your problem's not.
Just Willis, they had one of those on their drug
If it's
card.
good, it's
Like if
same.
you saw something wrong, you would check it.
Right, but the thing is, you never know who is going in there and putting air in the cup.
Well, they used to do that with Tracy.
Oh, yeah.
Nurses do that, so you need to check it. All right.
We're gonna teach y'all, that's another check off next week. And how to check the pressure with just your stethoscope and a 10 cc syringe. You actually can listen.
That's actually the best one.
The minimal leak technique and minimal molecular volume. Two different ways you can check the pressure. But we'll get into that with me. Next, move on to page 5. Laryngoscope handle. This is very interesting. We have batteries in here. And you use C batteries. And if the battery's bad, you put the blade on, it's not going to light up. I'm sure you have good batteries.
They're always C batteries. I think it's like a universal thing. They're all the same.
They have fiber optic ones too.
Nowadays, yeah,
Plug into the charger.
those are nice. We don't have those here. Not the gyroscope, just a different blade. We'll show you in the hospital does.
All right, if you're getting ready to intubate somebody, and the doctor tells you, get ready for intubation. So what do? You get one of these, check the batteries. Otherwise, when he comes over here to intubate, the blade doesn't work, he's going to throw this at you. He's going to get really mad. So make sure you have a good battery. The next one is the blade. This straight blade is called, and the curved blade called Macintosh. You need to know this.
Can I tell y'all much? I always tell this. The way I learned the curved Macintosh, straight Miller. I used to date a guy from England, and if y'all know anybody from England, their teeth, they don't have good dentistry over there, right? Because they have a universal health care, and the teeth's always crooked. His family name was Macintosh. Now, he had straight teeth, or I wouldn't have been going out with him. But Macintosh is a British name. British have curved teeth. Miller is an American name. Americans have straight teeth.
Think of Macintosh with
Got
a
that
C
guy yesterday.
and Miller with
Oh, yeah.
I-L.
He was German or something.
Miller straight.
Yeah, Miller,
L.
I-L-L, straight.
Straight.
Macintosh has got the C.
That's good
That's
too.
good.
Yes.
That's how I got it.
Thanks. Whatever it takes.
Kaifo, or was it Kaifo? How do you say her name?
Typo.
She's the one that said that.
Beer
That's how
will
she
get you
remembers.
straight. Miller beer will get you straight.
Miller.
Miller beer.
We'll get you started. Whoa.
I don't think anybody's gonna miss that now.
Yeah, exactly.
They're all three.
Anyway, it's drilled in your brain now. Okay, now, I got the Miller in my hand. How do you attach it? See this little groove over here? Pick it up like that.
Oh, you see.
Y'all are gonna have to
Now.
practice this over and over and over. Just putting that
And
on.
you see a little light bulb, and if this is loose, it
It
ain't
won't
gonna work.
light up.
And if it's blown, it won't work. Make sure you tighten it up.
Now, is there a way for that thing to slip out of there? That light, like down there?
If you don't put it in right.
Just kind of-
You would know if it was that way.
And they have different sizes, so make sure you put the right size. So how do you attach? This is important because last year I have seen students go, this won't work. How do you put this in? It's easy. You
can
just
see it.
look
Yeah,
at
you
it.
can look at it and see the groove.
Yeah, look at the groove. Look it up and down.
And how did you
Mine
put
does
it,
the complete opposite
how
of
did you
me.
put it down there? What did
I
you
go
do?
Always
upside
taught,
down.
we always
Push it
taught
in.
to use the
Push
thumb,
it in.
just block it with the thumb,
Push it in, lift it.
Yeah,
Keeps
but I
you
mean,
from looking
when
like
you
a
go down,
door
it's
if you
no, it's
lift
not
it.
hard to go down.
Got it from here. Do we have extra ones?
Behind, can I scoot through?
Yeah.
Yes, there's one in here.
Check, I think this worked this morning. Yeah, I do it completely backwards for Biddy.